from the European Treatment Center for Drug Addiction, Ms. Suda Bias, from the Turkish Billing Cancer Society, and our Miss Isabel online from the Singapore Anti-Narcotic Association, SANA. Ladies and gentlemen, thank you for joining us today. So today's session will include a presentation from each speaker of around 6 to 8 minutes with a Q&A session after the last presentation. So I would like to start our session today by introducing our first speaker, His Excellency Dr. Rustin Yusof, from DG National Anti-Drug Agency, Ministry of Home Affairs, Malaysia. So he's has a Master of Social Science in Political Science from the University of Kebangsaan, Malaysia. Dr. Rustin Yusof embarked on his career in 1995 and as an Assistant Director in Research Division of the Prime Minister Department, where he played a key role in national policy research and strategic planning. His proficiency in governance and international relations earned him the position of First Secretary at Malaysian Permanent Mission to the United Nations in Geneva, Switzerland, from 2001 to 2005, where he was actively involved in diplomatic negotiations representing Malaysia. In 2011, Dr. Rustin Yusof was appointed as Minister Councillor at the High Commission of Malaysia in Canberra, Australia, where he played a key role in enhancing bilateral cooperation between Malaysia and Australia. Upon his return to Malaysia, he assumed several leadership roles, including Deputy DG of the Research Division at the Prime Minister Department in 2018 and Administrative and Diplomatic Officer at the Public Service Department from 2018 to 2019, concentrating on policy development and government strategies. His senior leadership skills further developed during his tenure as DG of National Registration Department from 2019 to 2023, where he managed Malaysian National Identification and Civil Registration System. Subsequently, he served as the DG of Immigration Malaysia from 2023 to 2024, significantly contributing to border security and modernization of immigration services. Since September 2024, Dr. Rustin has been leading the National Anti-Drug Agency, NADA, Malaysia, as a DG. In his capacity, he has been at the forefront of national strategy for drug prevention, rehab, and enforcement. His efforts have also strengthened partnership and with both domestic and international stakeholders. Now, I would like to welcome His Excellency Dr. Rustin Yusof to deliver his keynote speech. Please.
Terima kasih, Dr. Ahmad Fairuz Muhammad. In Malaysia, we call it terima kasih. Thank you very much. Dr. Ahmad, as a President of the President in Malaysia, quite long introduction. And speakers, excellencies, ladies and gentlemen, pleasant afternoon to everyone. First of all, I'd like to thank and commend the effort of the Green President Malaysia for organizing this important side event during the 68th CND. And I would like also to thank other co-sponsors here, namely the Singapore Anti-Narcotic Association, SANA, European Treatment Center for Drug Addiction, and Turkish Billing Cancer Society. It is a privilege to be here today to talk about the importance of inclusive approaches in drug prevention and recovery, particularly for women and the elderly. Drug addiction is a challenge that transcends age, gender, and socio-economic backgrounds. It is a serious concern which affects society and public policy in multiple fields. As you might already know, National Anti-Drug Agency, or NADA, is an agency under the Ministry of Home Affairs Malaysia dedicated in combating substance abuse. NADA's mission encompasses three key areas, namely preventive drug education, treatment, medication and rehabilitation, and enforcement and security. NADA also actively engaged with various strategic partners to enhance its effort in combating drug abuse and providing comprehensive support to those affected. This partnership includes collaboration with government agencies, NGOs, and international bodies. While Malaysia has made significant strides in tackling substance abuse, there are still rooms for enhancement to ensure that our prevention and recovery program address the unique challenges faced by vulnerable groups such as women and the elderly. Malaysia strongly believes effective drug recovery is not just about treatment. It is about reintegration, support, and community involvement to guarantee a lasting and meaningful recovery. Recovery from drug addiction is a long-term process that goes far beyond just medical detoxification. It involves psychological healing, rebuilding relationship, restoring self-worth, and reintegrating into society. Unfortunately, many recovering addicts, especially women and the elderly, face stigma and rejection, making their journey even harder. In 2024, 3,807 or 4.5% of the 83,678 clients, I repeat, 83,678 clients treated by NADA in Malaysia were female substance addict, and total of 9,067 or 11% were elderly individual aged 50 and above. For women, recovery is often complicated by family responsibilities, social stigma, and economic dependence. Many women fear that seeking help might result in them losing custody of their children or being disowned by their families. Therefore, we believe on providing a family-friendly rehabilitation program, vocational training, and mental health support to empower them in their recovery journey. For your information, NADA Malaysia offers various vocational training programs for women aimed at developing skill and improving employability. These programs are designed to empower women, especially those affected by substance abuse, by providing them with opportunities to learn new skills and build a brighter future. Additionally, these programs aims to equip women with practical skills that can lead to employment opportunities. By offering comprehensive training in various fields, NADA Malaysia is committed in helping clients gain confidence, financial independence, and sense of purpose. This vocational training initiative not only support the professional growth of women, but also contribute to their overall well-being, enabling them to reboot their life and create a positive future. Ladies and gentlemen, our findings shows that drug addiction among the elderly is often linked to prescription drug dependence, loneliness, and untreated mental health issues. Many older individuals who struggle with substance abuse do so in isolation without adequate support or recognition from their families and society. As the world is currently facing unprecedented health and socio-economic challenges due to the aftermath of global pandemic, it is essential for nations to collaborate on innovative solutions to promote resilience and recovery. This involves strengthening healthcare system, addressing economic disparities, and ensuring the well-being of all citizens through comprehensive support and sustainable development initiatives, as these issues also significantly impact women and the elderly. On this note, I would like to applaud again the excellent work of the Green President of Malaysia in raising awareness and conducting prevention program at school, universities, and community level. Today, I call on everyone to commit to creating a society where individuals in recovery are given a fair chance to rebuild their lives free from stigma and discrimination. As policymakers, healthcare providers, educators, employers, community leaders, and citizens, we all have a role to play. Let us strengthen our policies, enhance our support networks, and foster an environment where drugs prevention and recovery are not only possible, but also sustainable. I wish today's event a success may our contribution today will have to build a better world for our younger generation tomorrow. Thank you.
Thank you very much. Thank you very much, His Excellency, that excellent speech. So Dato already highlight the importance of reintegration and to remove the stigma, because we highlight this topic because these are the vulnerable group that we need to take more attention and give more support, and we need to have concentrated um, intervention in the community to help among the women and adults. Thank you again, His Excellency Dato Yusof. Right, so we go for the next speaker is Miss Isabel. Is a certified counselor and caseworker with Singapore Anti-Narcotic Association with a master's in counseling. She has worked extensively with those who struggle with addiction as well as with their mental health. She is also heavily involved in communities to develop best practice in working with female offenders and has been leading recovery support group for individuals on the path to desistance. So, Isabel, the floor is yours.
Okay, give me a moment. Let me share my screen. Can everyone hear me clearly?
Yes.
Okay, great. Okay, so the slides, you can see the slides as well?
That's right.
Okay, then that's great. Okay, then I'll just start. So I think good day and good evening, depending on where you're watching from, to everyone present, and thank you for your time. My name is Isabel, and I represent SANA, which stands for Singapore Anti-Narcotics Association, and we are an NGO that supports substance abusers in Singapore. So in conjunction with Singapore prisons, we actually published a study very recently, around late last year, in the Journal of Women and Criminal Justice. So for myself, I'm one of the authors of this paper, and I will be sharing with you more about our study, which is named An Exploration of Human and Capital Factors of Desistance for Female Offenders in Singapore. Okay, but before that, let me share with you the definition of desistance, because it's a word we'll be hearing very often. In our study, we refer to desistance as a cessation of all criminal behavior for at least 5 years. So this is also in line with Singapore's measure of long-term recidivism, which is at the 5-year mark. We decided to embark on this study due to the uprising trend in drug-related incarcerations for women. As you can see in this table, despite the fluctuation in numbers, there's still a very concerning upward trend. And despite this upward trend, there are still limited studies done in Singapore about the incarcerated woman and her experience. Studies have also demonstrated the differences between the male and female experiences of desistance, and in order to prevent reoffending, there is a need to understand their unique desistance factors. So I'll show you this chart as well, which is retrieved by Central Narcotics Bureau, which is CND for short. It's a ministry sub-department that is responsible for all matters related to drugs in Singapore. So based on this data, we actually see that even though the percentages for total abuses by gender remain the same, we see an increase in the numbers in female versus male offenders. In fact, the new abuser statistic is even more concerning, because we are seeing the number of new male abusers drop, and yet there is a rise in new female offenders, again reiterating the trend of the rising female offending and the need to understand their pathways to desistance. And thus, for our research, we hope to A, understand which factors contribute to maintaining desistance in formerly justice-involved women, and B, how these factors impact the process of desistance. So guiding this entire study, we actually use the Good Lives model as a guiding framework, because GLM, for short, has been an ongoing framework that has been used throughout the Singapore-based rehabilitation systems as a basis for intervention, SANA and prisons included. So GLM is actually a strength-based theory that takes into account the offender's unique life experiences and focuses on their strengths and their goods and resources that can be leveraged upon as we plan their goals. So the concept of GLM actually says that the offender has a pool of resources, or we call primary goods, that can be used or improved in order to provide an improved sense of self, as well as to improve their motivation. So broadly, they're actually separated into two categories, one being human capital and one being social capital. Human capital talks about a person's skills and abilities alongside their internal value and moral systems. Social capital, on the other hand, considers the external systems and how supportive they can be, including support services, their personal networks of friends and families, so on and so forth. Okay, so we'll just quickly go through our methodology. We gather a convenient sample of women from in-care and aftercare agencies. In-care referring to while they are incarcerated, and aftercare referring to after their release. And these women would have had an experienced crime-free lifestyle for at least 5 years or more, and ranged from age 34 to 61. We crafted questions guided by the GLM domains and conducted face-to-face interviews for over a year, which were audio recorded, and they were also intentionally open-ended, so we may capture unexpected data or observe trends and patterns that may not be detected in a closed-ended questionnaire. So the interviews later underwent several rounds of transcribing, identifying themes and sub-themes along the way. Okay, so we'll move on to the results. So in this study, we actually noticed that all of the resistance narratives of these women were one of redemption scripts as opposed to a condemnation script. So a redemption script is actually something with an more uplifting and positive undertone, compared to a condemnation script, which is a lot more negative, a lot more self-blaming, a lot more guilt-laden. So this actually suggests that the redemption script mindset is actually very imperative for successful resistance. We also found that women discuss their roles as mother very frequently, above all else. So a study by Bachman actually found that women often needed to reinforce a new identity in order to disavow their old one. So in this situation, the old identity being a drug addict or ex-offender. We also found that there was no downtime for women as they reintegrate into society, immediately attempting to or expected to re-assimilate into their social roles. This immediately, they also immediately take on the domestic mental load, and the success or the failure of their assimilation will determine the likelihood of their successful resistance. And finally, we also found that the women had a very strong ongoing theme of connection and were less concerned with tangible resources such as money or housing. Not to say that it's not important, but it suggested that with the right support and connectedness with her social domains, a woman can still very much thrive and work towards gaining these tangible resources later on. So with our findings, it led us to wonder if there are other theories that may better frame a woman's experience of resistance. And we found that the relational theory actually summarized the woman's experience need for connection very well. And this was something that GLM could not effectively detect. So in the context of resistance, relational theory actually suggests that repeated disconnection from her relationships have psychological consequences. And over a period of time, this leads to offending behaviors. So this theory actually postulates that the priority should actually be to rebuild and maintain positive relationships before we develop the sense of self as an independent unit. Okay, so some limitations include our small sample size that may not have been an accurate reflection of the entire female offending population within Singapore. However, we position this as an exploratory study, and so holistically representing the entire female population was not our intent. And the fact that the interviews were self-reported may also be very limiting. Having insight from their significant others or their family members may provide a more useful point of view in understanding the context of resistance as a whole for them. For our recommendations, going back to the good life model versus relational theory, our findings actually argue that we need to leverage more on the woman's bid for connection in order to improve her chances for successful resistance. So this actually means to focus on her ability to reintegrate back into her relationship and her systems. And this might require a relook at the rehabilitation process, as well as the pre-incarceration processes, perhaps even starting as early as the point of their arrest, to perhaps consider allowing the incarcerated woman to perform due diligence with regards to her current social responsibilities, as opposed to her stark absence due to her sudden removal from the system. And with that, we've come to the end of Sana's presentation. Thank you for giving me your attention. And if you are interested in further collaboration with us or with the Singaporean rehabilitation system as a whole, feel free to reach out to my colleague Chin Yan at this email below. Yes. So thank you. I can see you clapping, but I can't hear you. Maybe we have a few minutes left. Are there any questions about the presentation, about the study that I can take?
Of the session.
Virus, you're muted.
Yeah, initially.
Okay, so from the Sana presentation, again highlighted the reintegration of the recovery process and to the society, to the community, and rather than we just remove the connection and between their social support system. All right. So next we go for the Green Cancer Malaysia. So now I would like to introduce our next speaker, Dr. Tengku Amatullah Madiha, Tengku Muhammad. So Dr. Tengku Amatullah Madiha is a public health medicine specialist at the Faculty of Medicine and Health Science, University of Science Islam Malaysia, USIM, with expertise in healthy aging and mental health. Dr. Madiha has been actively involved in research, advocacy, and community engagement in this field. Passionate about public health and preventive medicine, Dr. Madiha has led the numerous health awareness programs, particularly focusing on promoting holistic well-being and healthy aging among the community. Through workshops, seminars, and outreach programs, Dr. Madiha has contributed significantly to enhancing public knowledge on mental resilience, aging gracefully, and overall well-being. With a strong commitment to improving population health, Dr. Madiha has received numerous community grants for aging and continues to collaborate with community organizations and policymakers to advance research and initiatives that foster a healthier society for all generations. So now I would like to invite Dr. Madiha to deliver her speech. The floor is yours.
Thank you very much, Dr. Fairuz. Can everyone hear me?
Yes.
Yes, okay, excellent. So good afternoon or good evening from wherever you are. So I'm from Green Crescent, Malaysia, and today I'll be presenting on in terms of elderly addiction, prevention and recovery. Just to give a background, what I found was quite interesting actually, because in terms of when we're looking at the elderly per se and we're looking at the prevalence of addiction, there's actually a lack of data in terms of the global prevalence of addiction, specifically in the elderly population. Because in the previous years, I think the focus was more on between ages 16 to 65. So if you look at previous reports from different countries, a lot of it is between these age. So therefore, there's a bit of a lack in terms of data from other countries, especially from globally in terms of older adults. However, whatever limited evidence there are, it shows that it's actually on the rise. And here I present the US Department of Health. And this is actually a national survey of drug use and health from 2002. And this report was actually specifically analyzing older adults and substance abuse. And you can see here that there were actually 7.1 million older adults who had substance abuse in the past year, which led up to 9.1%. And if you look at the numbers here, there's more in terms of male rather than female. And you can see here, it says in terms of alcohol use and drug use. So alcohol use is AUD and drug use is DUD. So in terms of alcohol use in the male is actually more than the drug use, but in terms of female, it's roughly similar. Okay, so when you're looking at substance abuse or disorders among the older adults, a lot of the report shows in terms of in terms of alcohol and cannabis. There has been reports on prescription drugs and illicit drugs, but for me, the interesting one is actually prescription drugs, which we actually maybe currently with polypharmacy and a lot of multimorbidity, this is actually something that we should focus on. So when we look at looking for papers regarding substance abuse or in terms of potentially inappropriate medication, I found that the other term for that was actually potentially inappropriate medication. So for this one, as we know with older adults right now, and we have an extended life expectancy, a lot of older adults are actually on many medications due to polypharmacy and a lot of chronic diseases. So because of this, there are tendencies that they might actually have inappropriate medications and take certain medications more than the others, and are at higher risk of substance abuse in terms of medications. So therefore, healthcare professionals, especially physicians, have to actually balance the appropriate drug use, drugs that are prescribed to elderly. So if you look for the
Internet is good.
Because of her? Because of her connection. Oh, she's disconnected.
hello, was I lost?
Yeah. Can continue.
Okay, all right, hang on. Let's see. Okay. Is that okay? Can you see?
Yes, we can see it.
All right, so if we look at the prevalence and if you compare it between the years and the trends, we can see that it's actually an increased prevalence in terms of potentially appropriate medication. So I think this is something that looking at the population currently with the aging population, we have to look at this problem and do something about it. Okay. Okay, so another interesting point in terms of addiction among the elderly, I think we can definitely see that there is also a trend in terms of internet addiction. It's not only a problem among the youth, but it's also a problem among the elderly. And this another terminology that I found in the literature was that problematic use of the internet. So, and then again, this is actually, there's a lack of data in terms of this. And I found some data from the US, which showed there's an increasing trend from 12% in 2000 to 77.5% in 2018. And in Switzerland, there was 10% in the year 2000, and this increased dramatically to 73% in 2017. So this is another aspect of addiction among the older adults that we have to actually look at. And the implications are actually a lot. The first one is actually physical in itself. So, you know, with looking at the internet and scrolling on the phone, you can have problems with the eyes, more sedentary lifestyle, and a problem with posture, as you're not, you know, you might just be sitting on a couch all day, and the tendency of to actually lower your head and position your head lower to look at the screen. So this is one aspect from it in terms of physical. And then there's also implications for mental health. So again, I think the Excellency just now, the DG of NADA mentioned about social isolation and feeling lonely. So this was initially maybe they were scrolling through social media trying to connect with other people, but end up maybe not actually connecting with other people rather than just looking at social media. So it can be a double-edged sword in terms of that you can actually use it to contact other people. But if you are then reclusive and you don't actually socialize, then it can lead to another problem in terms of social isolation and not going out from the house. So this is another aspect that we have to look at. So in terms of our NGO, Green Crescent Malaysia, in the past 2 years, we have actually been actively engaging older adults in our community. We initially started with advocacy, whereby we introduced just basic mental health, signs and symptoms and different signs and symptoms of depression, of anxiety. And also we also introduced internet addiction to older adults in the community. So it was really interesting because we get a lot of interesting questions from them, and they love to ask questions to clarify things, and they can always say that, oh, my grandchild, I think, has internet addiction. So, it's something interesting because we want them to know about all these different types of addiction, not just for themselves, but also for their family and the community. And last year, we actually had an engagement program with this is Puspen, which is a community rehabilitation center for drug and drug abuse. So we did have a program with them. However, we are still in early days in terms of treating or seeing drug cases ourselves. However, in terms of prevention, we are actually actively engaging in that. I think overall, when we look at the scenario currently, because of the trend in terms of increasing life expectancy and aged nation, and I think Singapore itself has lots of elderly people as well. So we have to look at what can we do in terms of prevention and recovery. So I think we go back to the basics. So in terms of prevention, education and awareness is important, as when we go down to the grassroots level, we can still find that there's a lack of awareness in terms of this. But in terms of from a healthcare perspective point of view, we have to actually create awareness among the healthcare professionals to just be careful and be more cautious in terms of prescribing medication, because we don't want older adults to actually be dependent on pain medication, etc. And then I think my colleague just now from Isabel Tan mentioned about strengthening social support and mental well-being from the presentation. So I think this is actually very important, because we have to create a supportive surrounding community and also family, so that they feel that they don't need to resort to addiction or any substance abuse, and promoting healthy lifestyle. So this is also important, because then it gives them other things to do and creates a more healthy environment. In terms of recovery, I think overall, we still have to do a lot for this. We still have to create an environment where the recovery is actually integrated, holistic, and age-appropriate care. And maybe, as one of my panelists mentioned just now, not to take them out, but keep them in the community if it's possible. And in terms of the government policy development, and also increasing more community engagement, and with additional evidence-based focused research with addiction among the elderly is actually important. I think that's all from me, and these are my references. So if you do want to contact us, you can contact us on I think where's my Madiha at usin.edu.my, and I think that's all. Thank you very much.
Thank you very much. All right. So again, Dr. Tengku Madiha highlighted more on the elderly. The first speaker talking about women, and now we're talking about elderly. What is the main addition among elderly, and then the intervention that we need to focus for the elderly. So only if you see many activities, we focus on in the young age group, adolescents, but here we bring the topic how important, what is specific addition related, evidence-based related on the among the elderly. Okay, that is very interesting studies. All right, thank you again, Dr. Tengku Madiha. So we'd like to have also our Excellency, His Excellency Mr. Ikram bin Muhammad Ibrahim, our ambassador. As the Ambassador Extraordinary and Plenipotentiary of Malaysia to the Republic of Austria, with concurrent accreditation to the Slovak Republic. Essentially, Mr. Ikram also as the permanent representative of Malaysia to the United Nations and International Organization in Vienna. So actually, His Excellency Mr. Ikram every year he's joined our CND side event from Green Cancer Malaysia. So can you give the full support? Okay, now we continue the next speaker. Dr. Thomas Hijau from European Treatment Center for Drug Addiction. So let me introduce Dr. Thomas. So he is the General Director as the therapy Zealand involved. I know this, right? It's okay, right? Okay. As also President of EuroTC, European Treatment Center for Addiction and Mental Health. So Dr. Thomas, born in 1955, is an expert in addiction field with 45 years of experience in treatment. So he can share a lot. Prevention, research, and international exchange. As clinical psychologist background, he has been director of treatment of Bulan, Austria, largest center for the treatment of drug addict for more than a decade. After a period as international consultant, he founded a private residential treatment center, the Bulan Bisan Zentrum, Neppenhall. Okay, which was redefined after 10 years of successful experience into the therapy Zalem. I'm better off. Is it okay?
Yes.
Okay. Sounds providing treatment for addiction and psychosomatic diseases. His work features the implantation of specific program for special target group as adolescents, mothers, and children, dual diagnosis patients into the therapeutic setting as well as enlarging the therapeutic setting to nature through outdoor therapies. Industry. He has for many years been president of the Vienna NGO Committee on Narcotic Drug with consultative status to the UN, board member of ICA in the International Council on Alcohol and Addiction, and long time president of EuroTC, European Center for Drug Addiction and Mental Health. So as an expert, he has been involved in numerous European projects and is a member of the Council Civil Society. So now I would like to invite Dr. Thomas. The floor is yours.
Thank you very much for the invitation. It's an honor, and for the introduction and for the topic. I think it's a key topic which we follow up for years. So in this very short time, I want to give a little flashlight on good practice on history concerning also EuroTC, which has members in around 20 European countries. Just slide, please. We see since many years, since 40 years, I believe this is the problem that there's always this male orientation in treatment. Treatment was always for male, not for female. And so EuroTC always focused on, also in the sense of the transgenerated trauma therapy, because addiction is so connected with trauma always, to provide special programs, not only gender oriented, but in the beginning it was many programs for women and children, which was very necessary, and there was a steady working group, international and the European treatment centers found a very high level of treatment programs integrating mothers and children, which was also certainly very gender oriented, and further on the gender approach became important in the facilities to be gender sensitive. Today we would say more gender neutral, but at this time it was gender sensitive, so to motivate more women to come into treatment into these male-oriented facilities. Next slide, please. So what we saw about the outcomes were sometimes very good, but the best practice doesn't result in a secure funding, and so we always have, if we talk about special programs, we have funding problems, and if it comes to Europe, there's a European drug strategy, but as we see, it's not equal. It's very different in the European countries, and so it's quite difficult to catch up with these special programs, which maybe in other fields in the health system would be more easy. And we see that in the addiction field, we still have, we are not so important when it comes to funding. And so sometimes good projects, for example, in the 90s already, there were a lot of the FREA projects about gender and the necessity of women and women in treatment. But it had very little effect over the years, I would say, in the everyday work, but became very specialized for institutions who were motivated to do it on their own cost. And so, as the European Commission now has again a focus on women and gender-based violence, I say in some way we are reinventing the wheel because we started with this topic to bring it up already 40 years ago. Next slide, please. The therapeutic community, which is the basic of our treatment, I said, is the right place to be gender-oriented and oriented toward elderly, because I think the development in most of the communities over the years to become flexible and to feature on the individual needs of the patient. And the therapeutic communities can provide the necessary measures also for the institution to prevent gender-based violence, to support necessities for the elderly. And the treatment center Iran Therapies Alone in Bali is very flexible oriented. So every patient, and we have all ages from 14 to 80, they have an individual program, and this fits well in the community because the community as basis always understands that there are different necessities. And so I would say this is an ideal system, which I just want to mention, but we could debate very long about this. Next slide, please. What is the situation in Europe? The EMCDDA always points out that there are the specific needs by women who use drugs, including always the intimate violence, gender-based violence. And then we heard some figures from Asia. It's like this, that in Europe, women make up approximately a third of all people with serious drug problems, and around only 1/5 of all entrants to drug treatment in Europe. And this is the same for other drug counseling facilities. So women are underrepresented, and so we see that there's still a lot of work to do. And the elderly, I would say, normally are always neglected because, in fact, I sometimes think they are not seen as further productive people anymore. And some say, let them use, they will not be, they will not have a benefit so much for the society again. Next slide, please. Gender is always connected, and treatment of gender with the gender-based violence, because with results of the Interleaf program, which we carried out in Europe, a big program about gender-based violence financed by the European Commission. And so we see that a very high percentage of women have suffered over the years always gender-based violence in the connection of the drug consumption field, but also in their families and in others. But what worried us is that 26.5 in this program, in this research, reported that they suffered institutional violence in institutions and also in treatment centers, not only in counseling centers or police, in the institutions. So I think there's really something to do. And therefore, next slide, please. We have in this program developed a toolkit. You can load it down from the EuroTC website, and there are different target groups addressed. This is about gender and gender-based violence, about prevention, introduction into the treatment facilities. And I myself was very astonished because I thought we are very gender equal in our program. When we introduced the toolkit, we saw that there were many things to do and many things to think about, and the violence starts always verbally, it starts in the system. And so this is very helpful, this toolkit, to really address. And we see also from research afterwards that women feel much more comfortable if this is taken into mind. Next slide, please. Something different now about the older people, the elderly. And this is a project Reserva from our Spanish colleagues from Barcelona, from the Sociedad Comunidad Research. Salud y Comunidad in Spain, and they had implemented this program. It's called CANTOR, Therapeutic Community, and so they featured about specific intervention after they saw the needs of the elderly people, and these were people over the age of 45, but most of them older, like in the retirement age. And through special intervention integrated into this usual treatment program. So they had the same treatment, but they had some special intervention. The elderly people, especially in direction of their cognitive situation, and they were tailored to the needs of this drug-dependent individual and had this mental perspective, some also about year-long drug use, in mind. You can see this also on this website of the Spanish organization. Next slide, please. And we see, I don't want to go in detail, but we see that only after 3 months of introducing this special program for the older ones, and you can see what they did on the website, the results were much better. So there was big progress in the mental abilities, also in psychosomatic abilities, it was in anxiety, depression. So very positive results, only if a not very complicated introduction of an idea of a special program. Next slide, please. This is the end. Picture from the Alps, which are here near our facility, a peak, the peak 100 kilometers here from Vienna. Good weather, you can see. We use it to go outside, and also with the old people. The old people, they like to hike, and maybe to finish, when we think about old people, because some say, what's the therapy use? But we have such good feedback from our old clients about their quality of life, and I think it's very important to have quality of life of people in mind, especially of the old people, because it makes a big difference if someone lies at home drunk or he goes out to the nature and in his 80s and has a very good sense of life. I think this is a very human and important perspective. Thank you for the attention.
Okay. Thank you very much, Dr. Thomas, for sharing about the elderly. We know that current public health, every country we have increasing of the lifespan. So therefore, this important intervention and sharing from the European countries intervention, then we can actually facing the same issues in ASEAN as well, especially Southeast Asia, whereby we have kind of neglected among the elderly that using these drugs addictions and others addiction as well. All right, thank you very much, Dr. Thomas. So we have our final speaker for today's event, Ms. Suda Rias from the Turkish Green Peasant Society. Okay, let me introduce her first. After graduating from Department of Psychology, she received a master's degree in clinical psychology as well. So now clinical psychology between me. So she completed therapy training such as schema therapy and cognitive behavioral therapy (CBT). She's currently continuing a PhD program and has been working at the Green Peasant Counseling Center, Yadam, for 3 years. Her areas of work area are substance, alcohol, tobacco use disorder, gambling, and internet technology addiction. So quite a lot. So she has provided psychotherapy and consultancy to both individuals with addiction to their families. Okay, so Ms. Sudavias, so welcome, and the floor is yours.
And just it's a great pleasure for me to be a part of this organization and also mention this important topic today, because addressing the unique challenges faced by these groups in substance use treatment and support is crucial for developing more effective and sustainable intervention. And this is my outline. I will mention about it in this presentation. I will discuss the risk factors and for substance use in vulnerable groups as elderly and women, and barriers to treatment access and their strategies for inclusive and effective support systems I will highlight also the role of pre-crisis and counseling centers in providing intervention to individuals in need. And this is the question, why do women and the elderly require a special approach? And we can start with women. They face distinct biological, social, and systemic challenges when it comes to substance use and recovery process. And biologically, women metabolize substances differently than men, and it making them more vulnerable to the harmful effects of substance. And socially, also, they encounter significant obstacles. It includes stigma and their caregiving responsibilities, also their economic struggles. And many women hesitate to seek help due to the fear of being judged, also facing social isolation and financial dependence to their family, and maybe workplace discrimination further complicate their ability to access necessary resources for recovery. And they have also some obstacles to treatment also play a crucial role. They have limited access to healthcare and rehabilitation services, and the lack of specialized support can prevent them also from receiving the treatment. And additionally, they be co-occurring issues such as trauma and their domestic violence, and there may be mental health problems. Also, disorders are prevalent among women struggling with substance use. Next, please. And also similarly, the elderly also substance use disorder in elderly individuals is often overlooked actually, as symptoms may be mistaken for age-related conditions. And their chronic pain, their loneliness and social isolation also increase their risk. While retirement also and increased free time may lead to substance misuse. And prescription drug use also for chronic illnesses poses a significant danger for them. And as older adults, they are more vulnerable to addiction due to their biological changes. And next slide. They both barriers to accessing treatment. Firstly, women face significant challenges when seeking their treatment. Maybe their fear of stigma, as I said before, and their financial dependence and lack of support systems. And cultural norms are important in this point, and the social expectations from them can discourage to reaching for the help. And similarly, the elderly also encountered some obstacles such as their mobility issues and lack of awareness about treatment options maybe, and their misdiagnosis of substance use disorder as a natural part of their aging. And for both groups, the addressing these barriers requires inclusive treatment approach and increased awareness and targeted support systems. And the substance use disorder, the recovery process for both, they both need biological support and psychological and social support, because the biological support plays a vital role in the process. Both women and elderly should receive medical care to manage their physical effects of substance use. And in addition to medical support, psychological support is also equally important. And through their personalized therapy sessions, and they can rebuild their self-confidence and strengthen also their sense of identity. Moreover, learning effective coping strategies for their stress and anxiety and depression symptoms, it enhances their emotional resilience. And the last, social support is also vital with their engaging with families in the therapy sessions, and they can restore their broken relationships with them. and build a stronger support system for them. And also their access to safe housing, legal aid, and their social services are essential for social support. And ultimately, the holistic approach is the main need. And I will mention a little bit in the green consent counseling centers in substance use disorder recovery process. And building on these comprehensive support strategies, green consent counseling centers plays a crucial role in substance use disorder recovery process by providing their specialized services to individuals in Turkey. It provides free psychosocial support for individuals, both addiction types, not of type, is better, and to better address the needs of disadvantaged groups. We have a working group on vulnerable population. It was established for focusing on developing effective intervention strategies for populations that face unique challenges, as including women, elderly, LGBTQI individuals. And we have for women, we have women support groups. It provides a safe space for female clients to share their experiences related to their substance use problem and recovery process. And these groups allow women to connect in each other and facing similar challenges and helping them feel understood actually. And also, procedural studies are existed for women in green consent counseling centers because sometimes they should attend sessions with their children. And we have an ebook, Women and Addiction. It is available online also in Yazan Virtual Library for public access. You can also reach it. And it addresses the unique relationship between women and addiction, and exploring its impact on family dynamics and providing recovery strategies of and the ebook also aims to provide a comprehensive understanding of the challenges. We have two different psychosocial support programs. One is KIBAP, which is individual addiction treatment program for women. It's a specialized approach to support addiction treatment processes for women. And the other is BAC, Independent Education Generation Program. It's also aimed to minimize the impact of addiction-related experiences on children of the addicted parents. On the other hand, for the elderly people, psychosocial support focus on the unique challenges the elderly individuals face, which are the loneliness, isolation, and their physical limitations. And we try to provide support to help reduce the risk of substance misuse. And we have also an ebook for elderly individuals, and it offers practical advice and coping strategies to elderly clients. And lastly, we have workshop programs, and it provides a great opportunity for them because they have so much free time, and they try to doing something in this free time in a meaningful way. And all of these programs support both elderly and human individuals to overcoming their challenges. And I think this is my last slide. Thank you all for your attention.
So again, it's the highlight again for us to back to basic biopsychosocial intervention. So not only focusing on the drug itself, and must give the full support and for the psychological support and social support and the reintegration. Okay, so now I think there is no another side event. I think So I think we can take a 5 minutes Q&A session, 5 to 10 minutes Q&A session. So now I open to the floor for any questions for all the speakers.
Yeah.
Please.
Thanks, Dr. Ahmed Fayrouz. I'm Dr. Ahmed Sam. I'm a psychiatrist from the Jordanian Anti-Drug Association. So thanks a lot for the whole panel. Well, doctors, I wanted to ask you a question. I thought with regards to the addiction of the elderly, is that probably like loneliness is the key word. So are there like any measurable parameter for loneliness like in Europe, in Malaysia, and in Turkey? Can you know, as we see, as we know, like and anything that cannot be measured cannot be judged. So is there like any measurable psychosocial parameter for subjective feeling of loneliness? So for example, like can we say like that the 80-year-old Austrian man is more lonely than the Malaysian or the Turkish or the Jordanian? I don't know. So do we have such a parameter?
Good, very good question. Maybe we can start with Thomas.
I mean, the
And
interesting thing
counter.
what we heard is that older people start getting internet addiction, and this is certainly also a part of social loneliness, I would say. But I would say there are 2 points. One point is that addicts who have a career over 40, 50 years, they are normally socially isolated. And we see different phases of the addiction, and they are very often, we would call it a resignation phase. And they have a lot of somatic difficulties normally, also especially in connection with alcohol. And so for them, it's very important to have this cognitive training, but also to be included again, very good in a community which has a positive perspective. And then we have these people who retire and they don't have a sense in life. And I would say loneliness is a good expression then. They come from their professional life. And in Austria, we see these people start consuming and getting alcohol problems if they don't find a good way to find a new sense in life. And so these are people sometimes who develop an addiction, and even in Austria now, cocaine addiction. We have many patients who started with cocaine when they were 55. And this is are 2 different topics. But I would say in psychotherapy, the question of relation and loneliness means I'm without good relation is always in the center.
Excuse me, can I add a little bit on that?
Yeah, please.
Okay, so you were if you're asking about like measures in terms of questionnaires for loneliness, actually there's a few questionnaires on loneliness specifically. So one of them is John Greville scale of loneliness, and the other one is UCLA loneliness scale. So in Malaysia, I think these questionnaires were developed overseas, but we in Malaysia have validated and translated it into in the Malaysian language setting, and we have used it to measure loneliness in Malaysia. So I think by using validated questionnaires like this, we can actually easily compare loneliness among different countries.
Amazing.
Yeah.
Thanks, Doctor.
So you got the title?
Yeah.
Okay, good. Any questions? Any other questions? We have psychiatrists, we have public health physicians, we have clinical psychologists. Before we end, any last questions?
The contacts of the doctor Amatullah. Her contacts.
Yeah, I will the contact. Okay, so if no other questions, so that's the thing that I think that we can develop. And you see nowadays we have a lot of innovative technologies. And we have like Dr. Thomas shares about the link, about the toolkits, and that we can share from other countries. Yadam Center also produce e-books. Now is the apps times. Maybe in the future, we need to have this app so that easy to be accessed all these validated questionnaire tools for us to use, sharing the resources. All right, so that's to move forward. Okay, so as part of the organizer team, I would like to express my gratitude to all panelists and participants who have made our event today successful. Thank you, and we are looking forward to our next meeting. Have a nice day. And then lastly, we have the photo sessions, right? Yeah. Thank you very much.
Thank you.